behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Long-Term Care Emergency Preparedness Educational Series, The Importance of Exercise. My name is Amanda Bennett, and I will be your moderator for this program. Now I'd like to introduce our speakers for the webinar. Jason Brown is the Director of Healthcare Emergency Management for the Public Health Management Corporation. PHMC, in cooperation with Pennsylvania Department of Health, provides management and oversight to Pennsylvania's hospital preparedness program. He brings over 20 years of experience in emergency response and management with various healthcare facilities, as well as experience as the chief of an all-volunteer fire rescue department in the suburbs of Harrisburg. Pamela Drake is the Deputy Director of Healthcare Emergency Management for PHMC and is an intermittent agency representative public health advisor for the U.S. Department of Health and Human Services. Pam is an experienced emergency manager with a demonstrated history of working in the hospital and healthcare industry, as well as government contracting and university settings for over 10 years, serving in various roles within the healthcare facilities and public health. Jason, I will now turn the program over to you.
Thank you, Amanda, for that warm introduction, and welcome everyone to this session today. As we go into the session, we'll start with some objectives of what we intend to go through. First, we'll go into a review of the exercise and preparedness cycles and how they relate to you as a facility. We'll discuss the importance of exercise to validate our plans and assumptions, making sure that everything we put on paper is true and, in fact, how it's going to play out in real life. And then discuss the importance of the exercise objectives and that evaluation guide. Last week, if you were in attendance, the program focused around the importance of evaluation of that exercise. We'll talk a little bit about establishing those objectives so that we have a clear evaluation. And ultimately, how we can use our exercises to build relationships in your local communities. With that, I'll turn it over to Pamela to talk about the exercise cycle.
Good morning, everybody. So I'm here to talk to you through a few slides about exercises and kind of the building blocks and exercise basics when it comes to how to make these work for your organization. The other thing I would ask you to keep a little bit in mind is explained sort of on this slide. I know this graphic may be a tiny bit small, but what you see is a picture of the overall exercise cycle, right? So that includes designing and developing your exercise, conducting your exercise, evaluating your exercise, as well as what is the improvement planning that follows on once you evaluate your exercise. And I'd also invite you to think about this in a little bit of a larger context. So this has been close to a year-long series on emergency preparedness education from the Patient Safety Authority. We talk about exercises in terms of a cycle and preparedness, but I would say that this cycle also reflects your overall emergency management program, right? So when you're looking at design and development, you do that very well with an emergency management team of individuals. So you have diverse representation of folks from your organization getting together, coming up with plans. There may be times where you enact those plans, you evaluate your plans on a regular basis, whether it's annual, biannual, whatever your planning cycle may be. And then you think about how you can improve your exercise, or rather how you can improve your plans themselves. So I would invite you to think about this discussion today, both from an overall emergency management program management lens, but also from the exercise itself. And why do we do exercises, right? Some may say, well, because we're required to. But from that overall standpoint of an emergency management program, we do exercises to validate our plans. And this is probably something, again, if you were in attendance last week and talking about the importance of evaluation, exercises, they shed a little bit of light on inefficiencies in our policies, our plans, and procedures. And you'll see how that comes into play when you talk about the overall concept of building and using an exercise. So on to our exercise planning. How do you actually go about that? Right, so there is guidance out there. FEMA actually has a program called the Homeland Security Exercise and Evaluation Program, or as we abbreviate it down to HSEEP. This is the sort of foundational program for how emergency management exercises should be conducted. It's considered a best practice or a gold standard. But I would note that it is also very scalable. If you feel so inclined and you end up going onto Google and searching for HCEP and starting to really read down everything that is involved in that program and things that make exercises HCEP compliant, it can be a little bit overwhelming at times. I will say within healthcare, we often have a much more narrow focus. We have a handful of capabilities that are described in that exercise program foundation that are the things that we consistently test within the world of healthcare. So I would encourage you not to be too overwhelmed or discouraged by the HCEP concept. It's just a guiding framework. It is intended to be flexible. It isn't intended to work for you. It is, however, intended to serve as a little bit of a baseline so that we ensure within the US, all facets of emergency management are being conducted with some similar baseline. That's really the overall goal of that program. From there, it does actually provide templates, guidance, and recommendations on how to develop, how to execute, and how to evaluate your exercises. So there are guidance documents and examples of how you can conduct meetings, agendas for those meetings, tasks that should be associated with those meetings, and so on and so forth. So moving on to exercise types, how do you know what sort of exercise you would like to do? I think very often we interchange the word drill and exercise, but as you can see on this slide, it is actually a slightly different thing, a drill. We have two different types of exercises. We have discussion-based and we have operations-based. So the seminar, workshop, game, and tabletop exercise are a lot more of a meeting, easy to do virtually as well as in person, or sometimes even in a blended format. And very commonly what we see seminars, workshops, games, and tabletop exercises used for is to walk through either a new plan or to walk through an existing plan. Oftentimes this is the first step in an exercise series, and typically discussion-based exercises are held before an operation-based exercise so that you can ensure that you are talking through plans appropriately and identify any significant or major gaps. They're also a really great way to involve external partners in an exercise with your facility so that you can build relationships. And Jason will get into that a little bit later, but exercises are a great way to build both internally and externally relationships with partners that may support your emergency management program. Operation-based exercises are a little bit more thorough. Often when we say emergency management exercises, operations type drills and functional exercises and full scales are the one we picture. Someone says, I'm conducting an active shooter exercise at my facility, and often we picture local law enforcement coming in, having some sort of actor, possibly notional gunfire, something like that, right? We immediately, our brains go to that highest level of exercise. A drill, however, is a perfect example of conducting or testing one aspect or part of your plan, policy, or procedure. So a fire drill is a great example. Someone pulls or sounds the alarm, everyone practices their run, rescue, alarm, contain, extinguish, and pull, aim, squeeze, sweep, whatever their fire-based policies are. And then you evaluate that drill based on, did staff and patients follow those procedures in a way we expected? If not, is there anything we need to evaluate? A functional exercise takes that drill to the next level of complexity and would have one or more things that are being tested. And a full-scale exercise is essentially reacting to a complex scenario with all hands on deck as realistically as possible. So you may not open supplies, for example, if you have a surge of patients or you have extra patients at your facility, you may not open your supplies so you don't waste them, but you may take them out of the container and place them on a bed, saying, I would dedicate this resource to this patient, for example. So those are just a little bit about the multiple exercise types you can conduct. When it comes to figuring out which one is right for you, I think that really starts with building the objectives that you're looking to test, as all exercises should begin when it comes to planning. But also really thinking about, do we need to talk this through with employees? Is this meant to be more educational, or is this meant to be more of a test of an outcome, right? So the educational side being more discussion-based often, and the operations-based side being more of the test. So again, this building block approach, typically In a perfect HCP compliant world, the federal government encourages you to have more than one exercise in a series. Realistically, that is recognized as not always possible. And typically what we see is folks either having one discussion-based and then one operational-based exercise, or figuring out what works for them at the time. And that is completely acceptable as well. You may have a regulation to satisfy that says you need to have a operations-based drill, and you have one of those because that is the time that you have allotted at your facility. That's acceptable as well. In a perfect world, though, it is considered somewhat of a best practice if you are testing a new plan or heavily revised plan or policy to have a discussion-based and then an operation-based. And you can see how that's really kind of a stepping stone from one to the other. You're doing increased planning and training, and you're increasing the capability that you have to respond to whatever disaster is being tested. When it comes to objectives and your exercise, this is the one, if you take nothing else away from this presentation, this is the slide that I would really like you to remember, not just because I really enjoy Agent 86 and Maxwell Smart, but you want to have SMART objectives for your exercise. What we mean by that you may have heard of before, is specific, measurable, achievable, relevant, and time-bound. So many times people say, I need to have an exercise because I need to have an exercise. I'm required to, or we should. But really take a step back and think about why you're exercising and what you need to exercise. A specific example of a SMART goal versus a slightly less SMART objective is, okay, I let someone know, versus notify the nursing supervisor as soon as possible, versus notify nursing supervisor and provide an incident briefing no later than 30 minutes after the event. Think about these examples and which one provides the most specific information possible. Obviously, this third one here gives you probably the most information, as you're notifying the person by their role. You are providing an actual incident briefing, and you are providing it within a certain time frame after the event actually occurred. If I step back here to your SMART objectives, this is the opportunity that you have to truly set yourself and your organization up for success when planning your exercise. So figure out what it is specifically that you need to test. Make sure that there is a measurable outcome. For example, 50% of our employees were aware of this procedure prior to the exercise, and now 75% of our employees are aware of this procedure after the exercise was conducted. Set an achievable or realistic goal for yourself so that you're not getting yourself and your staff more frustrated than you actually achieve throughout the exercise. Making sure it's something that's relevant. Oftentimes we see organizations jumping on trying to conduct a scenario that's in the news right now and is the popular topic. I would encourage you to really resist that urge, or if you have to go down that road, maybe your leadership is encouraging you to chase down that specific issue or incident. Make sure that you're using these specific, measurable, achievable, and relevant planning objectives to make sure that you're making it work for you. And finally, time bound. Make sure this is something that you have reasonable parameters set for, both within the exercise and then following that exercise, that you can actually correct the actions that you identify for improvement. So a little bit on scenario, which I mentioned previously, is keeping a brief overview of the exercise scenario, but keeping it grounded, right? So we've talked in previous sessions about your hazard vulnerability analysis. Many times that is what drives your scenario, and it's what drives the objectives of your exercise. So primary goal being something that's realistic, so that people don't, what we call, fight the exercise and say, oh, this is so unrealistic, I never want to participate, or I don't see the point in participating because this would never happen here. Sad, unfortunate fact, there was a large tabletop exercise in New York about a year prior to 9/11 that had to do with an airliner hitting a high-rise building, and many people said, oh, that'll never happen. I can't even pay attention to that. And unfortunately, that scenario did come to light. So occasionally, the scenarios are not as unrealistic as they seem. But again, really making sure that you pick a scenario that is driving the objectives that you need to test. So I would say make your scenario work for you. Don't be ruled by your scenario. Make sure that it links back to your facility in a realistic way and is grounded in your hazard vulnerability analysis. With that, those are some really quick basics on exercises. I am going to turn the slides back over to Jason to talk about exercise evaluation guides and evaluation of your overall exercise.
Thank you, Pamela. So, going through those objectives, and we're going to see that the next couple of slides here really focus on those objectives as well. Not only are they important to you creating the initial exercise and the exercise scenario of what you want to test. What are we validating by doing this exercise? Those objectives are very important to identifying that. They're also very important in identifying how we evaluate that exercise. So, if we're evaluating it to make improvements, identify where we may have gaps, identify the best practices that we've been able to glean out of our staff's response. Those are the types of things that we want to ensure that we capture in what we call an exercise evaluation guide. A lot of the times when we're doing exercises, we're picking people to participate in that event because of the role that they have on their day-to-day job. That's the role that they would have in the emergency. But we also have to find folks to evaluate. Are we doing the right things? Are we following our own procedures? Are we meeting the objectives that we have set forth in this exercise? And really that comes to that evaluator or exercise evaluator, maybe even evaluator controller, depending upon how many people you have and the resources that you have to be able to maintain your exercise. But that individual should be armed with that exercise evaluation guide. The evaluation guide provides that consistent tool to guide the exercise observation. A lot of the times I see this we do a very good job of evaluating the exercise dependent upon who the exercise evaluator is, i.e. they look at the things that they are comfortable and familiar with, and those are the things that they key in on. We don't always have the ability to have a subject matter expert being our exercise evaluator all the time, so developing an exercise evaluation guide that individual can follow to ensure that you're identifying the areas that you need to, that they align with your objectives. Maybe even providing them the capabilities associated with that particular objective, and what's the overarching target. And you'll see what I mean by those things in the next slide here. I can move them ahead. So this is an example of that exercise evaluation guide where we're giving that evaluator the overarching objective. What's the core capability that we have an expectation that this objective is going to drive? And then what are the individual critical tasks that lead up to them meeting that organizational objective? So in this particular case, they're looking at a county EMA and an EMS communication for responding to an event. So it's identifying those individual critical tasks, allowing that individual who's monitoring or evaluating an exercise, maybe this isn't their strong suit, but they can follow with what those critical tasks are that ultimately lead to that objective. So once the objective is complete, we can see what their observations were specifically for those individual critical tasks and their ability to complete said tasks or identify areas for improvement that we need to make to our plan, policies, procedures, whatever the case may be. Last but not least, what does that exercise do for us in building relationships? Whether those relationships are internal to your organization, allowing staff to see how other staff are going to respond, build confidence in their knowledge and understanding of your plan, build that relationship with a parent organization if you have one, letting them know and understand that you have a firm plan in place, you know how to enact that plan, put it into motion, and reduce the overall risk to the organization. A lot of the other relationships come from within your community. As you host exercises at your site, please don't forget your local community members that we may be relying on to respond to incidents at your facility, whether that be the fire department, police department, your local emergency management coordinator, Red Cross, your other healthcare coalition partners, or other government contacts. how would they interface with what is going on for your exercise? Whether they have an opportunity to participate is a different story, but having that the exercise invite go out to them for their participation, not only is it going to validate your plan, it'll validate some of your functions of how some of these organizations are going to respond, how you're going to interface with them. It's a lot easier to do it during a planned event where we can do it over a cup of coffee rather than during a response where time is of the essence and we need to make decisions to move forward. So with that, exercises really come back to our ability to establish good objectives, our ability to evaluate how we paired up to those objectives, and will aid us in building relationships within your local community of other representatives that we can rely on to aid and assist us in that event. On the last slide, there is some information from FEMA's exercise and preparedness tools on that HSEEP program. I encourage you all to check out the HSEEP tool. There's a lot of templated information that will help you in building your exercise, as well as panel and ICE contact information on the last slide. Thank you all, and I believe we will open it up for questions.
Thank you, Jason and Pam. That concludes the slide presentation portion of our program. Now we would like to begin our question and answer period. If you have questions, please type them into the Q&A box found at the bottom of your screen. Please click on the three dots, then click Q&A to open the Q&A panel and direct your question to all panelists, and we will try to answer as many questions as we can. Okay, we do have a question here. How or where do we go to get support for designing and conducting exercises?
Most of our healthcare coalitions across the state at this point have a training and exercise work group that is focused on, really the coalition's response, but participating in that group allows a lot of our coalition partners to glean off how that preparedness cycle and the exercise cycle functions, as well as getting a lot of that templated information, as well as seeking a lot of our other coalition partners for participation in your exercise.
Great, thank you, Jason. This concludes our webinar.